So Dr. Sharat will be talking to us on AI in Retina. Where are we today?
Thank you. Thank you, Dr. Manoj Khatri, sir. It was a great talk, Dr. Uday. It was a eye-opener. As you told, the biometry part of it is AI is coming everywhere, and in the IOL master is very much important further. So just coming back to the retina part of it, which has a very, very talkative nowadays in the part of artificial intelligence, where everybody we want to have a see the eyes and they have to diagnose the conditions. Where I'll just tell you what is happening nowadays in retina part of it. As Dr. Uday Devkan said, it is an hardware or a software that exhibits an artificial intelligence, and it can be able to diagnose the condition. So I just keep these conditions as already told. It has a lot of field. It's now a very wide field which can be seen, and it has a lot of applications. If you see, you go anywhere in the Google, Tesla, everything, there is artificial intelligence, a driving part of it. So why not in the ophthalmology and retina part of it? And retina, the best part is it has a lot of data. Has Dr. Uday Devkan said in his, he's a crowdfunding which happens for the IOL master. Similarly, for the OCT, fundus images and all, we get a lot of data. And with the data only, the artificial intelligence works. And we have a lot of data, including the digital fundus photo, OCT, B scan, and OCT angios. So mainly the three applications happens in the retina, especially it will be like a classification to diagnose whether there is diabetic retinopathy is there or not, or the segmentation, what is the type of diabetic retinopathy is there, it also has been come. And the prediction nowadays is coming more commonly. Like for example, if there is any changes in the retina, is there any systemic conditions like Alzheimer's disease is there or not, or any stroke history is there or not. The prediction in the future in 4-5 years, how the diabetic retinopathy will be there or not. The prediction also which works, and based on that there is like segmentations of SRF and all in the IMD and all we can able to see, and the prediction of the disease progression also we can be able to see. So how the AI in diabetic retinopathy is working? So DR has become the main focus of AI nowadays, and lot of studies and formulations are coming, and many patents are there over that with many companies, and also FDA has approved few of the diabetic retinopathy algorithms also. And India has a very highest database of the diabetic patients, and many patients are poor and are not able to come to the retina specialist or to the center, and there the screening of the diabetic retinopathy becomes important. And 2016, by the Google, they have done the deep learning data, and they've shown that the accuracy of 97% and specificity of 98% can be seen. And in 2018, the first one, IDR, was the first US approval which came for the diabetic retinopathy screening part of it. And now in India, we have 2-3 companies which mainly use the diabetic retinopathy screening part of it, where the patient, the trained optician can go and take a fundus photograph, and from there, that data AI can diagnose whether there are any conditions are there or not. If there are any some changes are there, then it can be referred directly to the retina specialist. Or by chance the AI is not showing properly, then the data can be directly connected to the cloud, and a doctor can see and also diagnose. So like mainly there are like 2 Zeiss, and the Remedy also has been come with this application which show very nicely how the DS screening is there or not. And we have done, there is a startup which have done the data to see in the mobile camera, if you are able to analyze it and if you prepare it, how it will be that. And around 40,000 images we have analyzed, and we see it has a very good sensitivity and specificity. And it also helps in the diagnosis of early signs and warnings of ARMD, whether the drusen is there or not. In diabetic retinopathy, like a segmentation I told you, whether the cottonwool spots, hemorrhages, and how can it be, the severity can be there or not, also we can able to see. And as I told you, the prediction, the Google and all have come with the human eyes to predict the heart attack, Alzheimer's disease, and various other conditions, even having a renal issues or not, also has been come with the AI. So these are the FDA approved one, European approved one, eye grading, red marker, and eye art. Now coming to the diabetic macular edema. So many, like as I told you, they initially take only one photograph and they try to see the disease is there or not. Now they started combining in glaucoma and retina, where they'll be combining in the retina the OCT and fundus photo and OCT angio, and they will say combinedly whether there's some changes or not. Yes, it becomes very large algorithms, but yes, they are coming up now. Similarly in glaucoma also they will attach OCT, RNFL, and visual fields to see whether there's some changes or not. Similarly with what they will do is like they'll look for the hot spots in the fundus photo and the macular edema, and then it will diagnose whether there is a macular edema there or not, whether it has to be treated or not, and also it helps in the prognosis part of it. So this is the one of the study where even this is also a small study where in the mobile based or most of the whatever the networks are there, it's very large based. Here this is the study we done in IISc, where we showed that even with a small almost of 100 kb data, 100 kb algorithm also can work, and it has a good sensitivity and specificity. And it also has a lot of things in retinopathy of prematurity, where many algorithms, especially the deep ROP, IROP, has shown it has a good sensitivity and specificity part of it. So this is a study in the deep ROP where they showed you the very good sensitivity of 95 to 98%. So this is the one where what they will do is like they will take the image, and from there they will segment the vascular network, how is it, and based on the segmentation the artificial intelligence can tell you whether there is a disease progression is there or not, how it will be, whether you need to treat or not to be treat. So similarly, another study also we showed you a very good sensitivity and specificity. And coming to the ARMD, ARMD also has a lot of OCT images, and it's a very subtle lot of biomarkers which are there to say whether it's progressing or not. And based on this these biomarkers, they have seen that 92 to 93% of the patients have good sensitivity and specificity by using the artificial intelligence. This is the one study where they show based on the deep learning models can they able to classify ARMD into wet and deep, and they have seen that almost 98% sensitivity to diagnose whether it is a wet AMD or a dry AMD. So here you can see how they classified the condition, normal or the patient has AMD or not. Based on the AMD, it can be exudative or non-exudative. So this is the image where they show what they will do, like they'll take a central part and they'll crop it into the required analysis, and based on that they will check any changes are there or not based on something called as hot maps. So this is the image where they show the hot maps, which can show there is some pathology in that area. So even in the OCT angio, which is upcoming right now, even the AI has come in that, especially where it has a lot of artifacts. It helps us to remove the artifacts. So similarly, if you see the initial image how it will be, and if you with the AI you can remove the artifacts and you can make more clear, and it helps us to diagnose. So this is just a vascular network. The CNVN membrane using the artificial intelligence can make it more clearly, and it helps us to remove the artifacts, even the disease detection also. So this is the latest DCARDnet which has come for the OCT angiography based diabetic retinopathy classification with the help of AI. So where it showed whether it has to be non-referable or referable DR, or no DR, NPDR or PDR. So as I told you, but even there are certain limitations like black box issues, there like data changes, the ethnicity changes, but the importance of obtaining the image with sufficient quality is also becomes important. If there is a sufficient cataract and all where the image clarity is not good, it may still give very much wrong diagnosis. And yes, it is a risk of the doctors to become addicted to technology. There is no alternative for indirect ophthalmoscopy, but still in the future it will come up and it will help us to diagnose many conditions which we are missing right now. Thank you.
Thank you, Dr. Sharat, for enlightening the use of AI technology in retina practice as of now. According to you, this screening and referral, this is one of the major area where most of this diagnostic equipments or diagnostic cameras are using. How much it has translated into a referral practice?
So most of the things in India, what I can say right now, so we have started certain, we have a mobile clinic where we use this technology, where the technician will go with the machine and will they take it and immediately to show the report. I can say up to from there the referral maybe 30 to 40% it has changed my practice with the referral part of it.
Okay, the question why I asked, the point we want to drive is there was a lot of inhibition initially when all these fundus imaging modalities or even for glaucoma diagnostic came into practice, as whether it's going to change the referral practice or it's going to affect your practice per se. So if you take data from one of the tertiary care centers in southern India, they have shown the jump in AI based practice based platform has gone 9 folds. So there is a huge gap which you can bridge with just an early screening and referral, and translate into your practice, and also benefiting the patients into the early detection and treatment.